Direct News TV. Toronto doctor suspended after texting medical information to patient's ex-husband, daughter. A Toronto doctor has been barred from practicing until August after she was found to have sent private medical information to a patient's former spouse, friends, and daughter over text and Facebook Messenger. Dr. Elika Safarzadeh, an endocrinologist at North York General Hospital, has been suspended from practicing for 5 months, from March 20 to August 20, after admitting to engaging in professional misconduct by sharing a patient's medical records on multiple occasions with their family and friends, a March finding published by the Ontario Physicians and Surgeons Discipline Tribunal, OPSDT, shows. The ruling cites an incident in which Safarzadeh admitted she engaged in professional misconduct after sharing a patient's medical records 3 times, in January and April 2019, with their family and friends. The ruling says the patient involved, a woman referred to as Patient A, was treated for the first and only time by Safarzadeh in 2015. After being admitted, Patient A received mental health care, it said. 4 years later, in 2019, Safarzadeh had ceased to have a doctor-patient relationship with the patient, but had engaged in a relationship with her former husband, who is also a physician, the tribunal found. Safarzadeh then accessed the medical records of her former patient without her consent, stating that the woman had been harassing and threatening her and she needed to reference past care in case of incoming legal action. A summary of the complaint, initially issued to the College of Surgeons and Physicians of Ontario's Inquiries, Complaints and Reports Committee reads. She then took photographs of the records and texted them to the woman's ex-husband, in what the committee found to be a serious breach of professional obligations, done mainly for personal gain. Additionally, the committee found Safarzadeh's conduct to be particularly problematic, not only due to the serious breach of confidentiality but the amount of time she spent reviewing the woman's medical record. According to the audit trail, Safarzadeh spent more than 5 hours in the complainant's medical record on January 16, 2019, the summary reads. The OPSDT also found that Safarzadeh told the woman's former husband she would share the photographs with their children and the public, if Patient A did not stop what Dr. Safarzadeh asserted was harassment, the ruling reads. The tribunal found these actions could have affected the patient's custody of their daughter. Safarzadeh also disclosed the woman's private medical information to one of their friends without consent, the tribunal wrote. In 2020, a number of text messages were sent to the woman's daughter, referencing her health, the tribunal found. The woman was made to feel scared and stressed by Safarzadeh's actions, the ruling states, causing her to become reluctant to seek treatment as she was afraid the confidentiality breaches would continue. She lost trust in the medical system and in her physicians because most of them worked at the hospital, the ruling reads. Little information regarding Safarzadeh's personal circumstances was provided in the agreed statement of facts, the ruling says, and because Safarzadeh admitted to the misconduct, a hearing and subsequent testimonies did not take place. The News Toronto has contacted Safarzadeh for comment but did not receive a response. North York General Hospital said they cannot speak to specific cases regarding patients and personnel, but that they take privacy protection very seriously. We have strong privacy policies and meet all requirements under the Personal Health Information Protection Act, FIPA, including reporting to the Information and Privacy Commissioner of Ontario when there is inappropriate chart access and conducting random audits, a spokesperson for the hospital told the News Toronto. While the tribunal found Safarzadeh's conduct to be extremely serious and worked to erode the patient's trust in the medical system, they also underlined that North York General's interim chief of medicine at North York General Hospital, Dr. Meryl Najafai, believes she has learned from her mistakes. The public's trust in the medical profession is fragile. It is undermined when physicians gain improper and unauthorized access to confidential medical records, which contain highly sensitive and personal information, and misuse it, the ruling reads. However, the tribunal also highlighted that Safarzadeh admitted to her misconduct, and, in doing so, spared the patient from having to testify and the costs of a hearing. They also said the interim chief of medicine at North York General Hospital expressed support for Safar Zadeh's return to the hospital after her suspension in a letter to the tribunal. The chief acknowledged that Dr. Safar Zadeh made serious mistakes but believes she has learned from those mistakes, the ruling reads. My name is Kingsley. Please like, share, subscribe and hit that notification bell so you can be the first to be notified whenever we post. You won't regret it.